strawberry tongue مشان ما تنسوها ابدا. وما هذه طبعا حاطين احنا strawberry, okay, but just like it, you'll never forget it. We call it strawberry tongue, okay, and this is the rash. It is as a sandpaper خشن, okay, and usually it will have desquamation. بصير عندك يعني الجلد ببلش يتوسف, okay, within about like 1 week. What is the case now?
كواساكي.
لا. scarlet fever. الحمى القرمزية في اللغة العربية اسمها الحمى القرمزية. Okay? Scarlet fever. Okay? How you are going to treat it? By penicillin. The drug of choice, it is penicillin for 10 days. For 10 days. Okay. Case number 12. 16-year-old girl, sore throat, fever, hard to swallow, swollen glands. Swollen glands عندها الغدد الدلولي. صديقتها في المدرسة, her friend had been diagnosed with mono. Okay? بس mono هذه الكلمة. طيب. No cough, bilateral enlarged lymph nodes, both side, okay? And she have axillary adenopathy. قلنا لها شوية فحصونة هذه just like she have adenopathy. يعني معنى شو adenopathy? They are enlarged and they have a tender to touch them, tenderness. Okay. Now, we are examining here. Look what we are seeing here now. That's what we are seeing here. Now, what is your diagnosis for it? شو التشخيص تبعكم على كل اللي حكيناه هذا؟ Okay? That's what we call it, and cervical lymphadenopathy حكينا عن ده. In this case, we don't have splenomegaly, ما عندنا ضخامة في الطحال, but the majority of cases they have splenomegaly, عندهم ضخامة في الطحال. So what's your diagnosis for this? The first one, it is mononucleosis. Mononucleosis بسميه باللغة العربية داء وحيدات النوى. داء وحيدات النوى, mononucleosis, okay? And we need to confirm it with a monospot. Again, unfortunately, nobody is doing it or thinking about it. المونونيكوليوسيس they call it الكيسنج فيفر, يعني الحمى أو مرض التقبيل. هذا بيجوا من معاناة أصدقاء مع بعضهم هيك, ممكن يقبلوا بعضهم كذا إلى آخره, يقول لهم الحالة هذه. Okay, it is a viral infection. Why we are mentioning it specifically? Because if you think it is very exactly similar somehow to the condition of streptococcal infection. So you might be giving now penicillin, or you might amoxicillin or ampicillin. If you give for this patient amoxicillin or ampicillin, he will have a rash, severe rash. It is not allergic. It is not allergic. I will show you the rash. So that's the reason you need to put a definitive diagnosis before you go and treat. Okay? Kissing disease we call it. And that's how we put diagnosis. Just like either by CBC, we'll find that we have abnormal lymphocytes, atypical lymphocyte. And again, this disease, it's having a specific kit to put diagnosis for it. Again, it is very simple. Within a few minutes, you will read the result and you'll be able to know if you have a kissing disease or mononucleosis or you don't have. Okay? Again, before you are going to use it. You see the rash here? That if you are using actually some ampicillin or amoxicillin for this type of patient, almost all of them will be having this type of rash if they have a mononucleosis and you give this antibiotics. Finally, we have just like specific things that I just want to show it to you about. Okay? Here, what we can see here, نحن نتكلم لأنه in the sore throat. So anything that will be producing sore throat, ألم في البلع والحلق, just like we mentioned, so we'll be able to be aware about it. Okay? Look about here, what you have here. You have an ulcer and it being surrounded by erythematous area. Erythematous area. Okay? So that's here you can see we have one small child, he has sore throat, and he has also a rash on his hand and in feet. Here is the rash. Look about this one. The rash in the hands and in the feet, okay? And that's what we can see. He is complaining, the major complaint, it is just like sore throat, okay? So now what will be your diagnosis? That's what we call it the hand, foot, mouth disease. It is a viral infection. هذا مختلف عن الفوت mouth disease اللي في الحيوانات. It will not be transmitted from animals. Okay, it is related to viral infection, and just like it is a Coxsackie virus. It is a Coxsackie virus. So usually you don't need to give antibiotics or any other medication, except just like let the case by itself, it will be resolved within a few days. Okay, now you have another case, you have a case of high fever, okay, and sore throat around, inside the mouth and around it, and drooling, urinary drooling, too much saliva, okay, and here as you can see it. What's your diagnosis? And you are going to treat it. What is the diagnosis of that? Okay. It is a herpes simplex virus, gingivostomatitis. Herpes simplex virus, gingivostomatitis. Usually, it will be resolved within about 2 weeks. Okay. How you are going to treat it? Can we give acetaminophen, paracetamol to decrease the pain? It is usually not effective. ليش عم نعطيكم التشخيص حتى تشوفوا الدواء اللي بدكم تستخدموه، okay? Usually acetaminophen or paracetamol, it is not effective, okay? So usually we need to relieve the pain by just like giving some local anesthetic agent. That will be the effective one. It is a herpes virus. Are we going to use acyclovir? Acyclovir topically, it's not effective. كمان مش عم تخسروا المريض مصاري. Okay? Acyclovir topically it is not effective, so don't use it. And also to give it oral or oral, it is not reasonable. Okay? So just then you go with by itself it will be resolved within about like we say 2 weeks. This is the last case, hopefully. Now look about this patient. Okay, I will put for you now many issues about this patient, and I will put it in one figure. Here. Okay. What you are seeing here, he has a fever for more than 5 days. Again, we have the major complaint on the shoe here. It's just like he's unable to swallow, sore throat. Okay. He has red eyes, both of them. Red eyes. He has changes in the hand and in the feet, okay, and discumation, usually at the tip of the fingers, okay, and we have the rash, almost widespread, but it will be just like in the genital area, okay, and you can see the lips now, it's been cracked, and so on. What is this disease? Kawasaki disease, okay, very good. So what is the Kawasaki disease? Why I mention it here, okay? Because one of the complications, we don't know what is the cause. It is not a viral, it is not a bacterial, it is actually an inflammation in the small and medium arteries. So one of the serious complications for it to produce a coronary artery aneurysm. How we are going to treat it? المعالجة. Steroid, we keep it to the last issue. The first thing that we give intravenous immunoglobulin. Intravenous immunoglobulin in high dose, and here is the difference, why I mention it, okay? That the treatment for it, you will give a high dose of aspirin. All the other issues that we mentioned about sore throat, whenever it is viral infection in a small child, absolutely you don't give aspirin to reduce the body temperature. Why you don't give aspirin? Reye syndrome. Damage to the liver, to the brain, and so on. Here's the only exception for this condition. If you have a fever in a small child and you put the diagnosis that it is actually related to a Kawasaki disease, then you are able to give aspirin in a very high dose. Okay? finally هذا الغطاء الكبير, everyone that will come to us will put diagnosis that it is a flu. Okay? We need to differentiate between flu and common cold. We need to between flu and common cold. Why we need to differentiate between them? التنتين مثل بعضهم. الرشح والزكمة. كلها بنقول نحن رشح وزكمة. Okay, there is a common cold and there is a flu. There is common cold and there is flu. You need to put differentiation between them. Why? Because in the flu, we might be using some antiviral medication. Some antiviral medication المشهور كثير هذا تامي فلو مثلا. تتذكروه. تامي فلو اسرتيماب and الزيناماب. These are, we can give it in the flu. It might be reducing the symptoms and signs and so on, but they are not effective at all in common cold. So that's the reason you need actually to make differentiation between common cold and flu. Both of them, they might be having a sore throat, which more common. Usually in common cold, you have common sore throat. Okay? And you have stuffy nose. احفظوها هذول تفرقوا بين التنتين. You have stuffy nose and sneezing. In common cold, you have stuffy nose and you have sneezing. However, in flu, you don't have these issues. You don't have these issues. So just make sure about these issues, okay? That just like to make your, okay. So that's about, now the beginning, أنا تعرف تشخصوا الحالات الأولانية, صح? Okay? So I guess that just like we jump over it. هذه من أول مريض اللي ذكرنا لكم إياها. المريضة كانت مصرة إنه بدها antibiotics. Now looks about 19-year-old. شو بتاخذ هذه؟ Score 19-year-old. Zero. Okay. Sore throat, cough. 0. There is cough, so it's 0. Okay. The patient temperature? 0. Okay, very good. And we can see that the lymph node, we said it is small. It's not painful. Small movement, which means it is a normal. So we give her a 0. جايتنا وطلع علينا في العالي. I need antibiotics. I am complaining of that and so on. Okay. Now what it will be? The final issues for her, it will be 0. كلها طلع 0. So there is nothing indicated. Don't give antibiotics and so on. Okay. And the same now for that, you know it how we just like we manage it. How we manage it. And finally, شو هدول الصور؟ Again, they're complaining عندك ولد صغير رضيع, infants, and is complaining of difficulty swallowing. Look about that. شو what is that? Fungal infection, candidal infection. How you are going to treat it? Nystatin 4 times per day for from 5 to 7 days. أفضل إنه just make swab تدهنه تدهين بالفم. Okay, for nystatin. We might be giving fluconazole once daily for 1 week. And why I put it for you this one? كتير هذه. You will find that in almost every primary health care centers that the small children they will get out وتمهم ملخبط بكل هالجنتن فايروس, right? شفتوهم كل الأولاد الصغار. It is rarely used. Okay? There is no advantage out of it. Rarely used. Don't use it. Don't use it. The other issue beside now nystatin or fluconazole, we might be using something here. Okay? We use the pure extra virgin coconut oil. Okay? We use white vinegar, الخل الأبيض. We use diluted solution or diluted preparation of baking soda. Okay? Or acidophilus. Or we use yogurt. How we are going to use it? Just like we put it on the nipple of the mother, and also we might be put it in the inside the mouth of the small, the infant. That's how it will be using it. What is this, your diagnosis? It is candidal infection in an AIDS patient. It is terrible. Okay? And I hope that you find something benefit for you, some advantage. Did you find any benefits out of this?
Yes.